Val Kilmer was once one of Hollywood's biggest stars. In the 1980s and 90s, he was known as one of the most talented and charismatic actors of his generation. From playing Iceman in Top Gun to becoming Batman, to his unforgettable role as Doc Holliday in Tombstone, Val Kilmer seemed unstoppable. But then, he disappeared from the spotlight. For years, rumors swirled about what happened to him. Some said he was difficult to work with. Others whispered about health problems. Val himself stayed silent. Then, in 2017, the truth came out, and it shocked the world. Val Kilmer had been fighting a brutal battle with throat cancer. The disease had stolen his voice, changed his appearance, and nearly took his life. But here's what makes this story so important for all of us, especially those over 60. Val's journey reveals critical warning signs that many people miss. His recovery shows us the power of determination. And his message about early detection could literally save your life or the life of someone you love. Today, we're going to tell you the full story of what happened to Val Kilmer. Stay with me, because what you learn today could be life-changing. Let's go back to 2014. Val Kilmer was still acting, still working, but those close to him noticed something was wrong. He seemed to be losing weight. His voice sounded different, raspier, weaker. He would sometimes have trouble speaking, but Val dismissed these symptoms. He later admitted he thought it was just aging, or perhaps damage from years of acting and using his voice professionally. This is a critical mistake that many people make, especially men over 60. Here's what was actually happening inside Val's throat. A tumor was growing on his vocal cords. Throat cancer, medically called laryngeal cancer, often starts with symptoms so subtle that people ignore them for months or even years. According to the American Cancer Society, the early warning signs of throat cancer include a persistent sore throat that doesn't go away, a change in your voice hoarseness that lasts more than 2 weeks, difficulty or pain when swallowing, a lump in the neck, unexplained weight loss, and persistent ear pain on one side. By 2015, Val's symptoms were getting worse. Friends and colleagues were concerned. Michael Douglas, who had survived his own throat cancer, reportedly reached out to Val, urging him to see a doctor. But Val resisted, and here's why his story is so important. He's admitted that he was in denial. He was a Christian Scientist, a faith that traditionally relies on prayer for healing rather than medical intervention. Val later said he didn't fully understand how serious his condition was. By the time Val finally sought medical treatment in 2015, the cancer was advanced. Doctors told him he needed immediate, aggressive treatment or he would die. The lesson here is crystal clear. If you notice persistent changes in your voice, throat, or swallowing, especially if you're over 50, don't wait. Don't hope it will go away. See a doctor immediately. Early detection makes all the difference. What Val Kilmer went through next was nothing short of brutal. And understanding his treatment helps us appreciate both the seriousness of throat cancer and the courage it takes to fight it. Val underwent a procedure called a tracheotomy. This is where doctors create an opening in the neck and insert a tube directly into the windpipe. Why? Because the tumor in his throat was so large that he couldn't breathe properly. The tracheotomy tube became his lifeline, and he still uses it today. Next came chemotherapy and radiation. For throat cancer, radiation therapy is particularly harsh because it's targeted directly at the neck area. Patients often experience severe pain, difficulty eating, burned skin, and complete loss of taste. Many lose dangerous amounts of weight because swallowing becomes too painful. Val has been remarkably open about how difficult this was. He lost a significant amount of weight. At one point, he was skeletal. He had to be fed through a feeding tube because he couldn't swallow food. The radiation damaged his vocal cords, leaving him unable to speak normally. But here's what many people don't understand about throat cancer treatment. It's not just physically brutal, it's emotionally devastating. For Val, an actor whose voice was one of his greatest tools, losing the ability to speak was like losing his identity. Dr. David Eisel, a head and neck cancer specialist at Johns Hopkins, explains that throat cancer patients often experience severe depression. They can't eat normally, they can't speak, they can't socialize the way they used to. Many patients say they feel isolated and invisible. Val went through 2 years of intensive treatment. There were times when doctors weren't sure he would survive. His children, Mercedes and Jack, stood by him through it all. In interviews, they've said there were moments when they thought they would lose their father, but Val fought, and slowly, painfully, he began to recover. The cancer went into remission. He had survived, but he would never be the same. The question became, what kind of life could he have now? Could he ever act again? Would he ever speak again? In 2022, something remarkable happened. Val Kilmer appeared in Top Gun Maverick, reprising his iconic role as Iceman. Audiences around the world were shocked and moved to see him on screen again. But how was this possible? Val could barely speak. How could he act? The answer is a combination of careful planning, the support of his co-stars like Tom Cruise, and cutting-edge technology that gave Val something extraordinary: his voice back. Let me explain how this works, because it's absolutely fascinating and offers hope to anyone dealing with voice loss. A company called Sonantic used artificial intelligence to recreate Val Kilmer's voice. They analyzed hours of his old film performances, interviews, and recordings from before his cancer. The AI learned the unique patterns, tone, and characteristics of Val's voice. Now, Val can type what he wants to say into a computer, and the AI speaks it in his voice, his real voice, the one we remember from his movies. It's not perfect, but it's remarkably close. Val himself has said this technology has given him back a piece of his identity. He can speak to his children in his own voice. He can give interviews, he can even act again. But Val doesn't rely solely on technology. He's also learned to communicate in other ways. He whispers when he can. He uses hand gestures. He writes notes. His daughter Mercedes often speaks for him, translating what he's trying to say. Speech-language pathologists who work with throat cancer patients say that Val's approach is actually ideal. He's using every tool available: technology, alternative communication methods, and the support of loved ones. Dr. Barbara Messing, a speech pathologist specializing in voice disorders, says that many throat cancer survivors struggle with accepting their new voice or their inability to speak. But adaptation, learning new ways to communicate, is key to quality of life. And here's what's truly inspiring. Val hasn't let his voice loss stop him from living. He still acts. He still creates art. He still connects with people. He's written a memoir. He's appeared in documentaries. He's shown the world that losing your voice doesn't mean losing yourself. The message here is powerful. Even when disease takes something precious from you, adaptation and technology can help you reclaim parts of your life. Don't give up. Now let's talk about something crucial: the risk factors for throat cancer. Because understanding these could help you or someone you love avoid what Val went through. Throat cancer is most common in people over 50, and it affects men much more than women. In fact, men are 4 times more likely to develop throat cancer than women. So what causes it? Number 1, tobacco use. Smoking cigarettes, cigars, or pipes is the single biggest risk factor for throat cancer. But here's what many people don't know. Chewing tobacco is even more dangerous for throat and mouth cancers. If you're over 60 and still using tobacco, quitting now can still dramatically reduce your risk. Number 2, heavy alcohol consumption. People who drink heavily are at much higher risk. And if you combine heavy drinking with tobacco use, your risk skyrockets. The two together are far more dangerous than either. One alone. Number 3, HPV, human papillomavirus. This is the same virus that causes cervical cancer in women. But in recent years, doctors have discovered that HPV is also a major cause of throat cancer, especially in younger patients. Actor Michael Douglas famously revealed that his throat cancer was caused by HPV. Number 4, poor nutrition and poor dental hygiene. A diet low in fruits and vegetables increases risk. So does poor oral health and dental care. Number 5, occupational exposure. People who work with certain chemicals, asbestos, or who are exposed to wood dust or paint fumes have higher rates of throat cancer. And finally, family history. If you have close relatives who've had throat cancer or other head and neck cancers, your risk is higher. Now, Val Kilmer hasn't publicly discussed what caused his throat cancer, but we do know he was a heavy smoker for many years. He's admitted this in interviews and has spoken about the regrets he has. Here's what throat cancer experts want you to know. If you're over 50, male, and have any of these risk factors, especially if you smoke or drink heavily, you need regular checkups. Your doctor or dentist should examine your mouth and throat carefully at least once a year. And if you notice any of those warning signs we discussed earlier, hoarseness lasting more than 2 weeks, trouble swallowing, a lump in your neck, don't wait. See a specialist immediately. An ENT doctor, ear, nose, and throat specialist can examine you properly. The 5-year survival rate for throat cancer caught early is over 90%. But if it's caught late, like Val's was, that number drops dramatically. Early detection saves lives. So where is Val Kilmer today? How is he living with the lasting effects of his cancer battle? Val is 65 years old now, and he's still creating. He's an accomplished visual artist, and his paintings and sculptures have been displayed in galleries. He says that art has become a new way for him to express himself, a replacement, in some ways, for the voice he lost. He has a close relationship with his children, who've become his advocates and companions. His daughter Mercedes frequently accompanies him to events and helps him communicate. His son Jack, who's also an actor, has said that his father's courage inspired him to pursue his own dreams. In 2021, Val released a documentary simply called Val. It's an intimate look at his life, his career, and his cancer journey. The documentary includes home video footage he shot himself over decades. Critics called it moving and brutally honest. And then came Top Gun: Maverick. Seeing Val on screen again, even briefly, was emotional for fans around the world. It was a reminder that Val Kilmer is still here, still fighting, still creating. Val has become an advocate for cancer awareness. He's spoken publicly about the importance of early detection. He's urged people not to ignore symptoms the way he did, and he's been honest about the physical and emotional toll of throat cancer. In interviews conducted through his AI voice or through written statements, Val has said something profound. He doesn't regret his illness. He says it taught him about resilience, about what truly matters, about the importance of family and creativity. He's also spoken about faith. Despite the fact that his religious beliefs initially prevented him from seeking treatment quickly, he says his spirituality helped him survive the darkest days of his treatment. Val's daily life is different now. He has to be careful about infections because of his tracheostomy. He can't eat certain foods. He has to manage the tube in his throat. But he's adapted. He's found ways to live a full, meaningful life despite these challenges. And here's what's truly remarkable. Val Kilmer is still working. He's still acting when opportunities arise. He's still making art. He's still connecting with fans. He hasn't let cancer define him or limit him. His message to others facing similar battles is simple but powerful. Don't give up. Adapt. Find new ways to express yourself. Hold tight to the people you love, and never, ever ignore warning signs from your body. So, what can we learn from Val Kilmer's story? First, early detection is everything. If Val had sought treatment when his symptoms first appeared, his cancer might have been caught at an early stage. Treatment would have been less aggressive, and he might have kept his voice. Don't ignore persistent symptoms, especially changes in your voice or throat. Second, lifestyle matters. Smoking and heavy drinking are the top causes of throat cancer. If you smoke, quit. If you drink heavily, cut back. Yes, even at 60, 70, or beyond, these changes can reduce your risk. Third, get regular checkups. If you're over 50, especially if you're a man with risk factors, make sure your doctor examines your mouth, throat, and neck at every annual physical. It takes just a few minutes and could save your life. Fourth, modern medicine and technology offer hope. Even when cancer causes devastating losses, like Val's voice, new technologies can help restore function and quality of life. Speech therapy, AI voice technology, and other innovations are constantly improving. Fifth, support matters. Val credits his children and close friends with helping him survive. If you or a loved one is facing cancer, don't try to do it alone. Lean on family, friends, support groups, and professionals. And finally, life doesn't end with cancer. Val Kilmer's story shows us that even after devastating illness, you can still create, still contribute, still find joy and meaning. Resilience isn't about avoiding hardship, it's about adapting and continuing forward despite it. Val Kilmer was one of Hollywood's brightest stars. Throat cancer took his voice, but it couldn't take his spirit, his creativity, or his determination. Today, he's a survivor. He's an advocate. And he's living proof that with early detection, proper treatment, and incredible resilience, you can overcome even the most devastating illness. Remember the warning signs: persistent hoarseness, difficulty swallowing, a lump in your neck, unexplained weight loss, or ongoing throat pain. If you experience any of these for more than 2 weeks, see a doctor. Don't wait. Don't hope it will go away. Early detection saves lives. Val Kilmer may have lost his voice, but his message rings loud and clear. Take care of your health. Pay attention to your body. And never give up fighting. If this video helped you understand throat cancer or inspired you in any way, please give us a thumbs up and subscribe. We're bringing you more important celebrity health stories that contain lessons we can all learn from.